pleasure to invite Professor Dr. Mazda Betty Dahlu to the stage. Please welcome.
Assalamualaikum warahmatullahi wabarakatuh. Okay, good afternoon to everyone. So my presentation is a bit different from the earlier. So this is very much pertaining to management towards improving the quality and efficiency of medical care. So I'm going to introduce to you case mix. I'm sure some of you are not familiar with the word case mix, and you may think that case mix is a mixture of cases, but it is actually not. Okay, let me go through the contents. It's not going to be very long, okay? But I think it is important for me to also so-called introduce to you what is provided payment mechanism, because case mix system is one of the provided payment mechanisms that in trend nowadays. Okay? KPM Ministry of Health has been implementing this in the last 5 years, and UKM actually has been doing this for the last 20 years, but only recently, in the past 2 years, it is something that is being recognized by Ministry of Higher Education. As you know, most of the hospital universities are under KPT or Ministry of Higher Education, and recently they had granted us to champion the implementation of case mix in various university hospitals. So it is important for every one of you, especially those from hospital universities, to know about case mix system. And within case mix system, it comprises of the RGs or diagnostic related groupings, which also be describing afterward, which will be mixed with the cost. And of course, you would really want to be justified pertaining to why it is important for us to know what the case mix system and how it is being implemented at UMMC, and also the impact of case mix on quality and efficiency of medical care, especially in our hospital. So these are the various payment mechanism. These are the various provided payment mechanism, as you could see. All this while, especially for Ministry of Health hospitals, they are given budget according to the previous years, and this is not very motivated, because when the hospital wants to invest, or when the hospital wants to come up with new programs or even to come up with new buildings, it is very difficult because they have to ask rather than based on what has been spent in the previous years. Okay, they would need some additional budget. So it's very difficult when the budget is given according to historical. Is there? I think there's echo. Is there echo? Yeah? Avoid that. Okay, the next one is based on reputation. As you know that many of the healthcare facilities, they are being paid in many countries previously by reputation. And this is based on the number of population, based on the prevalence of diseases in a particular catchment area. That is also not very encouraging. Okay, again, if a particular healthcare facilities catchment areas consists of many elderlies, for example, or many people with bad behaviors until they have many chronic diseases, then that budget would not be enough. Okay? And then the other one is activity-based funding. So this is the one that I'm going to elaborate today. This is according to disease management or diagnosis related groupings as used in case mix system. And so far, we think that this is the most equitable way of paying the hospitals, because it is based not only on the volume of the patients that is being treated by the hospital, but also based on the complexities of the cases, and of course on the procedures that need to be performed. For example, if you compare Hospital A and Hospital B has many cases, but their cases are simple cases. While Hospital A, not so many cases, but they treat complicated cases, and therefore the procedures that they are going to perform will be consuming many resources, and obviously you have to pay or you have to give more budget to Hospital A. And performance based, this is a kind of payment where it is a fixed payment, but on top of it they give some incentive when certain criteria for KPIs are met. For example, if the hospital is managed to do cost saving or meet the target according to the guidelines, which has given